The planet grapples with a deadly pandemic, but in Africa, the coronavirus is far from the only threat to people's health. From Ebola to measles, to a lack of protective equipment and government transparency, just how prepared is the continent? I'm Imran Gata, and today's Newsmaker is the impact of COVID-19 on Africa. We're investigating how the coronavirus is affecting regions around the world. At a glance, there are hundreds of cases across North Africa. But in Egypt, the government is accused of underreporting the number of infected patients. We'll debate why. At the opposite end of the continent is the worst-hit country, South Africa. However, just next door in Zimbabwe, the virus hasn't yet had much impact. We'll hear why healthcare workers there are still worried. But we begin in Central Africa with a look at how the Democratic Republic of Congo is coping. It just fought off an Ebola outbreak and now faces yet another deadly infectious disease. But it's not coronavirus. Despite more than 6,000 deaths in the last year, most of them children, the world paid little attention to what the World Health Organization in January described as Earth's largest and fastest moving epidemic, measles. Also an acute respiratory disease, is transmitted and infects people the same way as the coronavirus, but is far more contagious. So when it comes to battling COVID-19, does the DRC's experience fighting Ebola and now measles translate into preparedness or panic? Lots of questions. Well, to help answer some of them, I'm joined from Brazzaville, the Republic of Congo's capital, by Dr. Michel Yao. He's the World Health Organization's Program Manager for Emergency Response in Africa. Dr. Yao, good to have you on the program. Before I talk about DRC, I just want to take advantage of the fact that you're in the other Congo right now, and I want to ask you, how are things in Brazzaville right now?
The situation is like most of the countries with sporadic cases that we have, and also few cases locally. So far, this is the situation, and the national authorities have actually decided to go for a confinement measure starting tomorrow.
Okay, good to know that they're seemingly on top of it for the moment, and we'll be following that closely. Now, the Democratic Republic of Congo, where you're mostly based, it just overcame Ebola, and now it's battling both measles and a growing coronavirus problem. Tell me how it's coping, tell me what it needs, tell me how things are evolving.
In this kind of particular context, it's a real challenge. We may say even that in addition to these public health emergencies, we have also an ongoing humanitarian crisis with displaced population in some of the places. So it's a big challenge, and the health system is actually overstretched, and it's required support coming from different partners, mainly NGOs. We are lucky that since almost a month now, we did not have any Ebola cases, and the countdown started. We have 15 days to declare the Ebola outbreak over. So we were lucky to have this team still on the ground, that most of them actually been repurposed to deal with the coronavirus. So while having also some other team on the ground dealing with the measles outbreak, mainly in close collaboration with the partners. So the key point here is a strong partnership to be able to cope with these various crises that overstretch the health system, the health services that have been actually facing this kind of challenge, including insecurity, since quite a long time.
Right. Are there enough doctors? Are there enough nurses? Is the infrastructure strong enough to cope?
Without external support, it will be a major challenge. And it's why coordination around the Ministry of Health is critical. There is not enough health workers, nor even capacity, because in the case of coronavirus, you may need some more sophisticated equipment, including equipment providing oxygen, as well as mechanic respiration for people with the severe cases of this disease. So to do so, it's require a strong mobilization around the ministry to be able to scale up these facilities. Of course, there were some isolation structure for Ebola, but they need to be re-equipped. And we need also, based on the population density, to think about a worst-case scenario in the case of widespread community outbreak, to make sure that we can scale up and set up temporary structures that have bigger capacity, like what is happening now in some of the European countries. But here the challenge is resources. So how to mobilize equipment, how to mobilize protective equipment, and how to mobilize additional partners to be able to be prepared and to address the actual situation.
Dr. Yao, one of the things that we watched you do in the Netflix documentary in pandemic was reaching out to people to convince them that Ebola wasn't being brought to them by outsiders and that the World Health Organization was not there as a sort of occupying force or a foreign invading force. So you have a lot of people, a lot of locals who are skeptical of outsiders coming in, claiming to want to help. And you also have militias roaming around. Help us understand how difficult all of that makes it. So all the other factors that come into play that are beyond the different viruses that are actually attacking people.
These are challenges around control of this kind of deadly virus or disease. You have a lot of misconception and even cultural perception of the disease. So the community, the risk communication toward the community and community engagement is critical. It's one of the lessons learned from Ebola. Without the community, it's difficult to deal with that. And we can easily see in the case of coronavirus that it may require some of the confinement measures that are public health measures that communities have to implement in a very challenging environment where people are also fighting for day-to-day life. Having this kind of measure without having community on board is not feasible. So it's one of the interventions to quickly scale up, building on what has been done with Ebola, involving communities at the earlier stage, giving them responsibility will actually help to have them on board. And this is one of the critical activities to urgently be scaled up in this particular area.
Dr. Michel Yao, we wish you all the best with your work. It's been a pleasure talking to you. Thank you very much for joining us on the Newsmakers. To Egypt now, where some people argue a lack of government transparency and a crackdown on free speech are hampering the country's efforts to control and fight the pandemic. Adam Pletz has more.
Like many countries, Egypt has adopted a raft of measures to combat the coronavirus. Airports were shut on March the 19th. Sports and social venues, schools and universities, mosques and churches are all closed. Restaurants can only deliver, and a curfew runs from 7 in the evening till 6 in the morning.
إن سيتم تطبيق العقوبات اللي موجودة في قانون الطوارئ فوراً على من سيخالف هذه القرارات. العقوبات عشان نبقى عارفين بتبدأ بغرامات مالية تصل إلى 4000 جنيه وتنتهي بالحبس.
So far, Egypt has reported relatively few cases and deaths from the virus. But there are concerns that the government is underreporting the death toll, and the authorities have made it clear that they will not accept questioning of the official figures. On March the 20th, Cairo expelled a foreign journalist who reported on an academic paper suggesting that, as with other countries, Egypt's true case count is much higher. The study, which was published in the Lancet Medical Journal, looks at the disparity between the number of reported infections and an analysis of cases contracted by foreigners. There are several questions about the burden of COVID-19 in Egypt, as they have exported multiple cases over the past few weeks. We estimate the case number at around 19,000. That was more than 200 times the government's figure. Confirmed cases are only a function of the number of tests that can be done, so most countries have far more infections than those that are reported. But most countries also accept this to be the case. President Abdel Fattah el-Sisi says the reporting is transparent. But is the government seeking to control the narrative? If so, and the numbers are being massaged, it will only hamper the battle against the virus.
ولن نتمكن من مكافحة هذا المرض إذا لم تتوفر لدينا المعلومات الكافية لفهم ديناميكيته في الإقليم. ولا زال أمامنا الكثير لمعرفته عن هذا الفيروس الجديد.
Adam Pletz, The Newsmakers.
Well, to get more on this, I'm joined from Berlin by Amr Magdi. He's a Middle East and North Africa researcher at Human Rights Watch. And in Salmiya, Kuwait, we have anesthesiologist Dr. Ali Saad, who works in critical care. Gentlemen, good to have you both on the program. Amr Magdi, are you satisfied or dissatisfied with how Egypt has handled the coronavirus crisis?
Thank you for inviting me. I think it's beyond our mandate and expertise as human rights observers to judge the medical measures, but I would talk about the various human rights aspects of the outbreak in Egypt. I think we are really concerned about the government instrumentalizing and using the outbreak, COVID pandemic, as a tool to actually suppress free speech and suppress basic freedoms. We have seen, as the report mentioned, the Guardian correspondent, her permission or license to report in Egypt was revoked, and later she was actually forced by security agencies to immediately leave the country. And also they issued a warning for the New York Times correspondent for the same reason. Some local newspapers reported that the government had arrested 15, perhaps more people for what Egypt call spreading false news, which is the favorite slogan of the government to crack down on free speech and lock up people for criticizing the government. I think if we are looking to overcome this pandemic as a danger that actually threatens the whole community and doesn't really differentiate between rich or poor or rulers and ruled, I think it is in the interest of everyone that the government allows criticism, allows free flow of information, the right way to battle false information and rumors, which are definitely, a lot of them are flying around in Egypt and maybe in the whole world at the moment.
Right.
But the best way to tackle that is actually to allow access for information, to allow free speech. The government has been quite intransparent or non-transparent about many figures and numbers and facts that concern any follower. For example, the government usually does not allow us to know the geographic and age and sex distribution of the virus. And we have seen also increasing number of videos by doctors on social media saying that they don't have enough protective gear and equipment. We have seen a call by the Doctors Syndicate, which is the main doctors union in Egypt, calling for the health ministry to provide such protective equipment. Let me also mention one funny example. In the beginning of the crisis a month ago, the health ministry seems to have actually tricked doctors and nurses into going to one of the quarantine sites, not telling them what the assignment was about. And that means that the doctors were not enough prepared and not enough informed about what kind of risks they are going to encounter.
Okay, I mean, what's interesting is that you said we need to separate this out and it's beyond your remit to talk about the medical issues, but things like protective equipment, that becomes a medical issue as well, doesn't it? It's not just human rights. I want to bring in Dr. Ali Saad now because Amr Magdi has painted a picture here of a government who's not to blame for the virus. Of course, no government's to blame for the virus, but by starving the population of information and by cracking down on those who question what the government says and those who are asking broader questions, isn't it only going to make this worse, Dr. Ali?
Hi, sir. I'm happy to join you this Newsmakers program. Firstly, I am satisfied about Egypt was going. It is the worst health crisis of our times. Many countries facing strong access now for healthcare, not only Egypt. Egypt, we have to consider that as developing countries, we have many problems, start from economy, population. We have overpopulation. We have to consider that the main issue of this virus is spread is fast, especially by contact, by droplets. You have to control the population. So the ministry from the start, even it is just, I blame it is delayed little actions, but she started from actions from curfew before even starting to separate some hospitals for isolation, for quarantine, and they allocated the specialized and qualified doctors. Because as a doctor, I know the situation and I know the quality and the nature of this disease. It needs good collaboration, and it needs cooperation, and it needs all to be together from the doctors and support from the ministry, from the authorities. And I think they are followed by the WHO office, and they are giving reports. Yesterday they reached to 600, and they're giving numbers. My friend is telling, appreciate his aspects and his thoughts. He's telling this is fake and some news, and the doctor's going to nowhere. No, this is no one. I don't agree. I have many, all of my friends and all my colleagues going to the same hospitals, and they know the issue. Oh, yes, we have lack of resources, and this is all the world. We see Italy, we see Spain, we see even USA. They have lack of doctors. So we are like any hospital, as any country. The issue we are developing countries. We are not rich enough. But when we founded the disease, we start to face it by all of our strengths, by all of our resources. The minister, she went to China because she has enough testing. That's why this is the issue starting. They told Egypt cannot testing. Egypt had no enough.
Okay.
Why
So,
no
okay.
cases?
Okay. Okay. So allow me to bring Amr back in. Okay. I want to bring Amr back in. Amr, we're hearing from Dr. Ali, who's saying that you're not factoring in the context here. This is a developing country, and it's doing its best within the context that it finds itself in. Do you accept that?
Yeah. Well, I agree with Dr. Ali that the Egyptian government has made a lot of good steps, have taken a lot of good measures, and I think there is a close cooperation with the WHO in Egypt. However, I would say that, first of all, he said that I said that the government number 600 infected people is fake. I didn't say it's fake. I just said there is a lack of the picture here, lack of the complete picture. We don't know a lot of the details. And the number is definitely likely higher than 600. And that's in all countries in the world because of the limitation on the ability of testing. But what I'm saying here is that I think in Egypt, as well as a lot of autocratic countries, I think there is like always this like an inspiration explicitly or implicitly to be like the second China in the terms that it's an autocratic country that succeeds in limiting the number of cases and containing the epidemic with very, very, very authoritarian measures. But unfortunately, Egypt is not China. Egypt doesn't have the technology and the central power that China as a state has. And I don't think this example can actually succeed in Egypt. What my concern here is that in a public health in a very serious threat to public health, it's very, very important that the state shares available information with the public. For example, we saw 2 army generals, very senior generals, dying in 2 days, and we didn't know they were sick, and we don't know whom other people they might have infected inside
because we're running
the army.
Because we're running out of time, let me get a final response from Dr. Ali Saad. Do you accept that the government can be more transparent during this fight, that it can be more open and more forthcoming about the information, such as telling the public about who's infected, especially those who are within the army or those who are politicians?
And sure, we need the government to be more transparent. Any government we need. But the issue, any government, I think, in the world cannot tell the actual cases, even you don't know, because as Mr. Amri told, we have no enough testing. You have to do millions of testing, for the population now over 110. So we have to know. Other issue, we have many obstacles from the population cooperation and the resources and the locations, and for the financial issues also. So we cannot to be accurate or specific about the numbers. And even we heard before in USA, the numbers they're telling it can be above 150,000. But according to WHO, last visit 3 days before, they told after several days of meetings, they feel that it is making substantial efforts to outbreak. They have to do more, but significant work is being done.
Okay.
And according to this strategy, they are starting detection, laboratory testing, isolation, and they did a lot better than before. We hope more because this is communicable disease. But this is now a critical window to effective control that
Dr. Ali
outbreak.
Saad, I have to move on. And I think something we can all agree on is that more testing has to be done all over the place as we try and tackle this virus. It was good to shine a small light on what's happening in Egypt. I'm going to move on for now, but let me thank you, Amr Magdi and Dr. Ali Saad. Thanks for joining us here on the Newsmakers. Now, despite the pandemic, Zimbabwe has once again seen nurses walk off the job. In the past, it's been over a lack of pay. This time, it was a lack of protective equipment to deal with coronavirus patients. Today, the country is in lockdown, and the strike has been called off, but who knows for how long. Almost 2 years ago, I spoke with Themba Mliswa, an independent MP and former member of the ruling ZANU-PF party, about the duty of care that nurses and the government have for the people.
As much as I also feel for the patients and for people dying, my appeal to the nurses too is that you've been very nationalistic about this. You've been very patriotic, and you've paid a heavy price. But there's also human life which is there. Should we allow it to go? Because of that, everybody has a conscience at the end of the day. I would want their conscience to be their master. At the same time, government must not allow a situation like this to prevail.
Well, to unpack what's going on, I'm joined by Nigel Mugamu from Harare under lockdown. He's a journalist and founder of the online news publication 263 Chat. Nigel, good to have you back on the Newsmakers. Let me ask you, are you relieved that there's no nurses' strike taking place at the same time as coronavirus cases rising?
Yes, short answer, yes, I am. Look, we've got existing health challenges, which we spoke about last time. We had that discussion with Themba Mliswa. So those challenges haven't been resolved, and so we're still facing that on top of COVID-19.
Yeah. So tell me what it would mean for Zimbabwe to tackle coronavirus without its nurses.
I mean, that's the nurses, the doctors. I mean, it's our health sector is struggling as it is. We're struggling economically, and obviously we've got some political challenges as well. So to try and address and work through this COVID-19, which is a global pandemic, without the nurses would be, that's a catastrophe.
Yeah. Tell me what the biggest fears are of Zimbabweans. Is it that it would come from South Africa because South Africa is, in a way, exploding with cases at the moment?
I personally think that they are. I mean, we've got officially 7 cases. We've got one death a week ago, a media colleague called Zoro Makamba who passed away. I think that we are underreporting the number of cases that are in this country. We're not obviously able to test. I'm seeing aggressive testing in countries like Germany, UAE, and all that, countries like that. And we're not able to do the kind of testing that they're doing. So honestly, I think there are more cases than that. And I think that's a general sentiment when you speak to Zimbabweans.
Right. Nigel, even if the nurses are on the job and if the cases rise, tell me in a nutshell about the healthcare capabilities of Zimbabwe as a country. Can it handle this?
I don't think it can. I mean, the nurses, if you look at the reasons why they're striking, we spoke last time, they were striking over salaries, and along with that, it was also around equipment. The issue around equipment hasn't been resolved, and what they're asking for is protective equipment, given that they're the front line. They're the people, handling and dealing with, patients as they come into hospitals and clinics.
PPEs, they call it, right? Personal protective equipment.
Exactly.
Tell me about the enforcement of lockdown. Have you seen any evidence of it so far over the past few hours?
Yes, I have. So we've been in lockdown for just over 16 hours now. So it started at midnight. We've we've got, obviously there's, lots of images that are being shared on social media. We've been able to verify some of those images. We've been able to, some of our team members obviously out there in the field. If there is generally a lockdown, people have stayed at home. I also get the feeling that people have decided to stay home to see how the first couple of days. I'd love to have the same conversation a week from now to see if people can actually stay home. Government hasn't announced any measures for business, for small business. So, you think of the small guy running a small shop, 3-4 employees, rent is due, staff salaries. I mean, all these things are, can you really shut down for 21 days without financial support from government?
And the way COVID is going, it seems as if that 21 days could very well be extended all over the world, right? Nigel, good to talk to you. I've got to move on. I thank you so much for joining us here once again on The Newsmakers. And thank you for watching. We'll see you next time. Bye-bye.